All right, good morning, everyone. Happy Friday. Welcome to another edition of PT on Ice. Once again, I'm Jason London, and today I'll be talking about Nordic ski injuries going on the endurance theme. And with West Camp coming up next week, a lot of people are getting out there and starting to Nordic ski for the season, and the first races are coming up for the season as well. So for those of you unfamiliar with Nordic skiing, it's cross-country skiing, and there are two kind of main forms that people will do. Classic skiing, which I think most people traditionally think of when they think of cross-country skiing, which is very sagittal plane based activity where you're striding in the sagittal plane, and typically your skis are in a track, so they're in tracks, and you're basically not deviating from that very much. And then skate skiing is more of a lateral movement, or in the coronal plane, where you're striding from side to side. Of course, both techniques are using poling, and that's where some injuries can occur. So like most other endurance sports, Nordic skiing, the majority of injuries are overuse injuries, so they're atraumatic in nature. And for Nordic skiing, compared to running and cycling, there certainly is a lower injury rate, but they're getting injured nonetheless. And the more common injuries in Nordic skiing that are presenting in the clinic, starting with the upper extremities, would be medial elbow pain or medial epicondyle, shoulder pain from subacromial impingement syndrome, lower back pain, which is a big one, and then knee pain from patellofemoral pain syndrome. So let's start with medial elbow pain. So typically those skiers that are developing medial elbow pain are going to be getting that from during skate skiing. And it's usually going to be more novice skiers whose technique isn't really good. So they're getting excessive strain of the flexor pronator group, namely the pronator teres, the flexor carpi radialis, and then also with Nordic skiing, definitely the flexor carpi ulnaris too, just because of the way the technique is with the pole, where they're going to, when they are planting and pulling back, they're going to go into ulnar deviation of the wrist, as well as into some pronation. And as long as they're staying in the sagittal plane, that's usually not going to be too much of a problem. But what happens with development of medial epicondyle in Nordic skiers is they start getting kind of out of that plane, out of that form, and getting more of a valgus stress at the elbow. And then that strain is really what causes the overuse of those muscles and development of that medial elbow pain. So the main thing really to make sure that you're covering with skiers that are coming in with medial elbow pain in the clinic is to make sure you talk about their technique. And you don't necessarily need to be an expert in Nordic skiing technique. Try to get some resources in your community with regard to some coaches. But really just, talking about their mechanics, even have them bring their poles in if you don't have a good resource in the community to refer them to for coaching, and take a look at their technique and where that elbow is. Secondarily, which can also occur too with that, is it could be due to some underlying rotator cuff weakness that's allowing them to kind of rotate their arm in more to create that stress. So double check that rotator cuff weakness, and then treat it as you would treat any other person with medial epicondyle, with some eccentric strengthening of that flexor pronator group, some gentle stretching, maybe getting some manual therapy in there as well. So we'll move up to the shoulder. So subacromial impingement syndrome in Nordic skiers, like the development of subacromial impingement syndrome in the rest of the population too, is usually due to underlying weakness in rotator cuff, particularly the posterior cuff with the infraspinatus, teres minor, and the parascapular musculature. And so what's happening with them is during Nordic skiing, there's a ton of use of the upper extremities with poling, and if their posterior cuff and parascapular musculature isn't stabilizing, so that they again are tending to internally rotate during the initial plant of the pole, that is going to create that irritation in the shoulder. So again, looking at pulling technique but then really making sure that they have a sound posterior cuff as well as parascapular musculature. And then Nordic skiers use their lats a lot for power with pulling. So also making sure that they have good length or flexibility in the latissimus dorsi, and that's not causing them to be in a more internally rotated position as well. So a lat stretch is never a bad idea for a Nordic skier. And the lats, tight lats too, can certainly be affecting their lower back pain if they're coming in with low back pain. I'd say low back pain is the most common complaint that I see from Nordic skiers, and this is substantiated with a study by Barr in spine in 2004 that showed Nordic skiers were had a higher incidence of low back pain than non-athletic controls. And this can be due, as I talked about just a moment ago, due to some tight lats, but typically it's more due to decreased hip extension, so tight hip extension, which can come from a variety of reasons. It could just be tight hip flexors with the iliopsoas, and so really making sure that you're going in there and looking at hip flexor length with the Thomas test. And as we know that typically tight hip flexors is not just due to tightness in the hip flexors, it's usually due to muscular imbalance. So making sure you're looking at their core strength as well. Because if they're getting that tightness either through the lats or through the hip flexors, that's going to change, of course, the mechanics at the spine, as well as muscle length tension patterns, or so muscle activation patterns. So they're not going to be able to be moving how they should, and that's going to create more stress and strain at the low back, lumbar spine. And with classic skiing in particular, there's a technique called double pulling, where they're basically just flexing and extending through the back repeatedly while they're pulling, and their skis are in the track and they're not really striding at all. So that repetitive flexion extension pattern kind of also factors into their development of their back pain. So having that core lumbopelvic strength is really important, as well as spinal extensor strength. So make sure you're testing that as well, and really kind of diving in and figuring out what the underlying cause is, or causes are of back pain in lumbar in the Nordic skier. And Elrickson in 2004 in British Journal of Sports Medicine also did a prospective study showing that Nordic skiers, competitive Nordic skiers who went through a program of lumbopelvic conditioning as well as hip flexor or hip extension flexibility, had less occurrence or decreased occurrence of low back pain with Nordic skiing during their training and subsequent ski season. So again, back pain is probably one of the more common things that I see with Nordic skiers, and really making sure you're looking at the amount of hip extension they have, and if it's limited, why is it limited? Is it due to capsular tightness? Is it due to muscle length? And is there an underlying muscle imbalance that they need to work on? And then probably while they're rehabbing from their back, trying to have them abstain from the double pulling technique while they're classic skiing during training, and only resorting to that for competition. So lastly, patellofemoral pain, again, is the number one cause of knee pain in Nordic skiers. It's not nearly as common or prevalent as it is in runners or cyclists for that matter, but it certainly can occur with Nordic skiers. And the underlying cause is more or less the same as what you'd see in runner, usually lack of control from the hip, causing that increased femoral internal rotation. I'll say that patellofemoral pain, definitely like back pain, seems to be more prevalent during classic technique, with the skier getting too much internal rotation of the femur as they're going through their stride. And here too, I think, other than, in contrast to runners, I think here really looking at maybe using an orthotic for them to help with any excessive pronation, because they are in kind of a fixed system like they would be with cycling. So I'm much more likely to use an orthotic in a Nordic skier than I am in a runner. And again, that's just my underlying philosophy of, using orthotics for you with runners has worked. Keep doing it. But, I have more success, I'd say, and more of a reason to use orthotic in a Nordic ski boot than I do in a running shoe. Again, just because of the constrained nature and of kind of what you're trying to accomplish when you're skiing. You're trying to keep and maintain a flat ski and not roll in at all. And it's a very low impact sport, so you're not needing that increased pronation, or you're not needing pronation really to help absorb impact. So in addition to hip strengthening and squat technique, take a look at their foot mechanics and see if they would benefit from an off-the-shelf orthotic or a custom orthotic in their boot. So that's Nordic ski injuries in a nutshell. Again, medial elbow pain or medial epicondylation, usually due to pulling technique, maybe some rotator cuff weakness. Shoulder impingement syndrome, again, pulling technique and underlying parascapular and posterior cuff weakness, with also some tightness in the lats. Low back pain due to underlying lumbopelvic and spinal extensor weakness, as well as tightness in the hips with extension, perhaps also tight lats contributing, and then lastly patellofemoral pain syndrome at the knee, and really looking at that hip strength as well as if they would benefit from orthotic in their boot. So everyone have a great weekend. Have a wonderful Thanksgiving next week, and I will be back in a few weeks. Take care.